Specialty.
My occupational therapy specialism is primary care mental health. So the two parts to that specialism, the first is primary care. So that means I work with general practitioners, GPs. So I work in their surgeries and in the communities that they serve. So that can be in people's homes, in community venues, people's workplaces, or out and about in parks like this. Then the second part is mental health. So I work with people who are experiencing any kind of mental health problem. I'm not tied to any diagnosis. So people who came to the group today, for instance, I don't know necessarily what their diagnosis is. But more generally, if I'm working individually with somebody, I'll work with people who've got common mental health disorders like anxiety or depression, but also those people with more severe illnesses like complex post-traumatic stress disorder or bipolar disorder. But sometimes I work with people who have no diagnosis, or more often people who have what we call undifferentiated diagnosis. So that means that somebody is experiencing some challenges with their mental health. They may or may not have a diagnosis, but whatever that diagnosis is doesn't really seem to fit with the challenges they're facing now. But ultimately, everybody I work with is what they have in common is that their mental health is stopping them doing those everyday activities that they need to do or they want to do, and they're wanting help to lead a more fulfilling life. And that's where I come in to help. I chose to work in primary care mental health because of the really positive impact I think it has on people's lives as an occupational therapist. I initially trained as an occupational therapist over 25 years ago, and I chose occupational therapy because it really aligns with my personal beliefs and values. A big part of that is the way that occupational therapy views people really holistically. And so when I work with somebody, I'm able to look at their mental health, their physical health, the environment in which they live, and also really focus on what's important to them and what it is that matters the most to them. And I also, the other thing about occupational therapy is the way that we focus on on activities and occupations. So it's about what people do and how that helps to shape people and their recovery. So we work with people around all their activities. So it can be like washing and dressing, it can be going out to work, it can be cooking a meal with friends. So it's really varied what we do, and can be really fun. And the move into primary care was a natural choice for me, really, because of that synergy in the way that we work as occupational therapists and GPs work in viewing people holistically, working with the complexities of their life, and working in that really person-centred way. And that we get to do that not just with the individuals in front of us, but also by shaping the way that the communities that they live in. And for me, working in mental health in this way in primary care is such a privilege, because I really get to see people recover their health and happiness. And I see that how through engaging in activities, either ones they've enjoyed previously or discovering new activities, they can really regain their sense of self, their belonging to their communities, and the whole purpose in life. So the demands of the job compared to other occupational therapy roles, I would say mainly relate to the newness of the role. So it's the fact that in primary care, many people don't know what an occupational therapist does. There's limited infrastructure, and there's not many boundaries in place, and there's not much evidence-based guidance for us to follow. So it's more around that newness, but that's also really exciting because it means you get to be a part of really shaping that. So in terms of people not knowing what an occupational therapist does, or sometimes people have seen one small aspect of what an occupational therapist does. So they go, oh, yeah, I know that. I know that you'll raise a bed for me so that somebody can get in and out. So having to explain that wider role and how varied it is can be quite time consuming, but it's also really fun. It's really good to have that opportunity to be able to explain the distinct benefits of our role, and show people how proud I am to be an occupational therapist. Then I'd say the lack of infrastructure was a real challenge when I started in post. So I I didn't have a place to work. Nobody knew if I was in work or not in work. There was no processes, no procedures. So I had to set all that up from scratch. But again, that's been great because now I can see how the role is really growing. And instead of being just me on my own now, we've managed to set things up. So my team has 2 occupational therapists, a dietitian, 3 social prescribers, 3 wellbeing coaches and a care coordinator. So we've grown a team, and that's really exciting to be a part of. And I think the boundaries of the role, that was quite challenging at first. So I was basically given a population of nearly 40,000 people across 6 GP practices, 9 GP surgeries, and told to get on with it and provide some occupational therapy. So again, it's been great that was daunting at first. It's been great to be able to shape the way that I work and to learn with other occupational therapists. So both here in SAPA 5, in Sheffield and across the United Kingdom, about how we shape these roles. And we're trying to figure out what is the best use of my time? How can I help the most people in the most efficient way? And that it's still very much a work in progress. But again, it's great to be part of that and shaping the evidence base and the future evidence base of the profession to make it easier for others coming in. I think there's 3 main ways in which we improve the lives of the community. So firstly, it's about working with individuals. So working clinically as part of the general practice team to improve people's mental health, their day-to-day functioning and their participation in the activities and the communities that matter to them. Secondly, it's being part of a more focused team. So I'm part of a personalised care team. So that is with social prescribers, health and wellbeing coaches, care coordinator and dietitian. So we're working closely with that multidisciplinary team approach. We can make sure that anybody who comes to any of us can work with anyone else from the team as quickly as possible to get their needs met. So that enables us to improve people's general health and well-being, provide advice and support with the broader issues like housing, debt and employment that really impact on people's lives in a truly person-centred way. And thirdly, we work at a population level. So by partnership working with all the local voluntary and community sector organisations and with the general practice teams, we can address the needs of the whole population in the community, not just those who present at our doors, to make sure that going forwards as we design our services and we redesign them, we are truly meeting the needs of everyone in our community, and particularly addressing those health inequalities with those people who are least likely to have the best health outcomes. So I think we, as occupational therapists, can improve GPs' jobs in quite a few ways. So it's largely about saving them time. So one of the things that I can do as an occupational therapist is replace a consultation that a GP might otherwise do. So if somebody is coming in and they need general mental health advice and support, they don't need changes with their medication or physical interventions, I can have that consultation with somebody and provide the same advice as a GP and achieve a similar outcome. And then there's other people who I can help perhaps better than a GP. So this is those people who have really complex non-medical issues. So the way that us as occupational therapists work is we have more time to sit down and undertake a holistic occupational focused assessment to really understand somebody's life and what it is that matters to them. And then we can either work with them to make those changes, to make their life more fulfilling and satisfying, or we can refer them on to the voluntary sector organisations that we work really closely with. And those people can give them advice around their benefits or their housing, and they can run the activities like today, the health walks. And by working really closely, I've got that ability to introduce somebody in a much less daunting way to start doing those activities. And I can do the work that comes before that. So often what we'll do as occupational therapists is go into somebody's house in the first instance, get to know somebody there, build up that trust, and maybe get them out the house for the first time, maybe look at the routines of that person and try to make them healthier in a way that really supports their mental health. And we can help them with learning to cook again and motivating them to get on with their cooking. Sometimes it's about getting people out and about, like to the health walk or to arts groups, to exercise groups, or back into education or employment. It's just great to see people grow and become who they are again, or sometimes for the first time in their life.